Hey everyone, it's Dr. Namani and Dr. Louie back here with TheAthleteSpine, and we're really excited to have perhaps our youngest interviewee on the episode with us, and this is Maria Canillas. She is a 17-year-old high school junior who lives down in Florida, who probably had a procedure that she did not expect to have, had a diagnosis that she did not expect to have, and so we're going to kind of hear today from her how she found out about her diagnosis of scoliosis and the kind of somewhat innovative treatment that she ended up having to correct that. So thanks for joining us, Maria.
Of course.
Yeah, and so it's a fun topic, right? We've talked about scoliosis before, especially in this sort of adolescent age group, right? These preteens when they notice that there's a curvature in their back, and not always with pain. But like every instance we've discussed this in the past with Dr. Carlson and Dr. Bauer, it was these fusions we had talked about and getting people back to play after a multi-level fusion. But I think what we're going to be talking about today is there's actually other operations out there for scoliosis that allow you to continue to grow and still reduce the curvature. But let's go back to sort of the scoliosis and how you've kind of figured all of this out and what you were going through at the time, Maria. So how did this all start?
So I was like, I thought everything was fine, but I did have some pain in my back, like on one side. And it was like when I would lay down for too long, and then it would just like really like ache, and I would need to like massage my back there. And I didn't know why. And then my dad took me to do like an x-ray because he said that he saw me on the beach and I was like slanted. So I got an x-ray done and I had scoliosis. I didn't really know what it was because I remember they would like test everyone on it at school, but I didn't really know what it was or anything. And they said that they could either give me a brace that I had to wear for like, I don't know, like 2 years, which I really did not want to do, or I could get a surgery. And my dad told me like that I should. So I was like, I was fine with that. And it just like happened really fast because I didn't know that it was going to happen like so soon because it was like 2 or 3 months after like I even found out.
Yeah, and we were talking before the episode started. Your dad is an orthopedic surgeon, and he kind of relayed to us that it was his partner that had trained with Dr. Baron Launer up at Mount Sinai Hospital in New York City, and that's how you kind of got connected to him to have this different type of procedure, as Dr. Louie talked about. Oftentimes for scoliosis, we're doing fusion surgeries, but Dr. Launer is one of the leading experts in a technique called VBT, which stands for vertebral body tethering. And so, how did that first visit with him go? And did he, how did that whole conversation go in his office about tethering versus fusion and what kind of operation to have?
Well, I don't really remember the exact like numbers, but he told me that the the tether, wait, no, the one that with the rod.
Yeah, the
Mhm,
fusion.
mhm.
Yeah.
That one I wasn't able to play volleyball for, I can't remember. I think it was 6 months.
Yeah.
Then the tethering one was like 6 weeks.
Hmm.
So I had my club season starts in late November, like upcoming like December, and that was like my second year, and I really wanted to play, and I was like, I didn't want to just quit for a year. I didn't like that was gonna suck because all like my friends and my team, and I really liked my team, and I just wanted to keep playing volleyball. So when they told me about that one, I was like, fine. I was like, yeah, that actually works perfectly.
And did the thought of surgery, how old were you when you were having these discussions?
I was 12, about to be 13.
Okay. So were you scared at all? I mean, what were you thinking in
Yeah, it
terms
was.
of like clearly you didn't want the bracing for 2 years?
Yeah, I did
And so
not
what
want.
was going through your head when trying to compare the brace option to this technique that it's still surgery but could get you back to play earlier?
Well, the brace was already like a no for me. I was like, I'm not doing that because I knew that it was gonna be like uncomfortable and it was just gonna look like, I did not wanna look like that for 2
Yeah.
years, and I don't know, I just thought that the surgery like, I trusted the doctors and my dad, he was telling me that it was the best option, so I just went with that, and I'm glad I did.
Yeah, yeah. Just for our listeners, the differences between these two operations are pretty significant, and obviously, and both are really good operations. A fusion is meant to kind of realign the bones, using screws and rods, but then to fuse the bones, meaning that all the bones kind of grow into one long bone rather than being a bunch of separate bones. The tether is a very interesting technique because it really is it's utilizing the potential growth of the spine, and so you basically put a tether and you stop or reduce the growth of the convex side of the scoliosis, and you kind of allow the concave side to grow and catch up. Thereby, with growth, the spine hopefully straightens more over time, and you kind of avoid a spine fusion. So, in the setting of someone who's an athlete, the idea of trying to preserve motion, if it's a reasonable thing to do, is a really cool way to kind of get you back to sport faster while also maintaining the motion of your spine.
So tell us about after surgery, right? You get the surgery done. Clearly it goes well. And that's a huge sort of sigh of relief, I'm sure, from your standpoint. But what did the first few days look like? And then the first few weeks look like for you?
So, I don't remember the surgery, the only thing I remember from the actual surgery is, like, getting into the room and laying down, and then I was just, like, out, and then I remember being back in, like, the bed in the hospital, and I don't really remember much from that day at all because I was, like, on a lot of medication.
It's good that you don't remember much.
Yeah,
That's
but
our
I
goal.
remember it hurt really bad. Like, the first couple days was, like, probably the worst. I couldn't walk, I couldn't get up to use the bathroom, I couldn't do anything, I could barely, like, eat anything really, and I threw up a lot too. It was just, like, really, like, scary for me,
Yeah.
and I wasn't in school for, like after that it was fine after the first 5 days. After the first, like, 4 days, I think I could walk. I got
Mhm.
up and, like, just slowly walking with the stick thing, and
Yeah.
my friends were sending me presents and stuff.
Well, that's nice of them.
Yeah.
Yeah. So did you have a
Uh,
lot of physical therapy right away? And what did they have you doing in the first few weeks?
yeah, they, like, deflated my lung, and so I had to breathe through this, like, tube thing,
Mhm.
and I had to do that, like, every couple hours, I'm pretty sure, and just, like, breathe in and out, so, like, to get it back because, like, it was, like, hard to breathe kind of,
Mhm.
but that was pretty, like, easy recovery, and my physical therapy, I remember there was this woman that came in and she would, like, help me to, like, stand up and walk and stuff, and, like, I couldn't bend down though for, like, a couple weeks. I think it was, like, might have been 6 weeks.
Yeah. So now you're about 5 years out from the operation,
Yeah.
right? Do you feel like you have any restrictions in terms of regular activities, or motion in your spine, or your ability to play volleyball or any other sports?
Honestly, I don't think so. I think I would have been if I didn't have scoliosis, it's the same. Like, it would have been the same thing. There's nothing, like, holding me back or anything like that.
How soon after surgery were you able to start playing again, like practicing and then back into gameplay?
It was, like, 6 weeks after,
Okay.
so late November after that.
And when did you feel totally back to normal, like before your operation?
Um, like, in volleyball?
In
Yeah.
terms of, yeah, your ability to, I assume at 6 weeks you still weren't quite yet
Yeah,
back to
no,
100%.
yeah. I mean, it wasn't like I had to take it easy, but I still practiced, like, regular and just, like, put it, like, 110%.
Yeah. I think one of the really cool things about this technique, and this approach to treating scoliosis is it really, as you said before, kind of harnesses the growth potential. And now, for women, you're often close to being done growing around, age 17, 18, thereabouts. And so hopefully, this is something that's basically fixed for you, and you never really need another spine operation the rest of your life.
Definitely.
Yeah, she's like, I really don't want to have to go through this all over again if I don't
Yeah,
have to. Yeah. Yeah. I mean, I guess the last question we have for you, Maria, so there's a lot of people out there who are going through something that you went through, right? Where they're being told, hey, you have scoliosis. They don't know what that means. And they're told, hey, you have a big curvature in your spine. You've sort of been through everything, right? The thought process, the surgery, the recovery. What would you tell these, 12, 13-year-old sort of boys and girls that are just hearing about their diagnosis for the first time and what they may be looking down at over the next 1 to 2 years, and you being on the other side, what advice or words would you have for them at this point?
Well, just don't stress about it. It's all gonna be okay at the end. It just obviously sucks a little bit at the beginning, but it doesn't you're gonna be okay, and it's gonna be a lot better. And then you'll have a great story for yourself.
That's the most important part.
Yeah, exactly. Yeah. Right. Well, I think that's a great thought to end on. So, Maria, thanks so much for joining us today. We really appreciate you kind of telling everyone about your story, about your procedure that you went through, and your return back to high level athletics. So, thanks so much again for joining us.
Of course.
All right, take care, everyone. Don't forget to like and subscribe and follow us on Instagram at TheAthleteSpine. All right, take care.